Here is about psychotherapy. So now that we indicate that there are issues that people have, how do we help these people? So psychotherapy is all about how we help these people. This is the next chapter in your book. So therapies. In therapy, we're trying to modify how people think, feel, and act. So when you change and modify you, and transform yourself, you're going to change the way you think, which could change the way you feel, which changes the way you behave. Or some therapists work on, let me change the way you behave, which will change the way you feel, which will change the way you think. And some other therapists try to work on, let's change the way you feel first, and that'll change the way you think and behave. In the end, you want changes in all three of those. So let's talk a little bit about what is psychotherapy. I'm just going to leave that like that because I want to go to my attendance one easily before. All right, what is psychotherapy? It's any psychological technique used to facilitate, this has got to be positive change in a person's personality, behavior, or just their adjustment that's there. So there are techniques that therapists use. And when I use the word therapist, there are many, many different types of therapists. There are psychiatrists who are medical doctors. There are psychologists who have PhDs in psychology. There are counselors who have either master's degrees in psychology or counseling, or even PhDs in counseling. There are marriage and family therapists who specialize just in that, have masters or PhDs in that. There are social workers, who have masters in social work, or PhDs in social work. So there are many, many different types of therapists that are out there. And there's not one that's better than another, and I'll explain that later. What are some dimensions of therapy? Well, there is individual or group therapy. When you go into therapy, most people go into one-on-one therapy where they sit down with an individual therapist, but also you can do group therapy where you're with 5, 7, 8 other people with 1 or 2 therapists. And I'll explain group therapy later. Therapy can be based on either insight or action. Some therapists want you to develop insight into your issues, and if you develop insight into your issues, then the theory goes that you will take responsibility for your issues because you're figuring it out, and all the therapist is doing is facilitating, guiding, directing, making it easier for you to understand yourself. Those are called the insight therapists. Some therapists are called action therapists. They don't care about insight whatsoever. Let's just change your behavior. Let's get in there and change your behavior. If we change your behavior, then everything will be fine. Why sit around talking about you and how you got to be who you are? And that's what the insight therapists do. Some therapists are directive, some are non-directive. Non-directive therapists ask you open-ended questions and facilitate your questions. The directive therapists say, this is what we're going to do, and this is what you're going to do. And we're going to follow this plan. But all therapists should be supportive and positive. They should be supportive and positive. You don't want to go to a therapist after you tell them what their issues are. They sit there and go, ha ha, that is a problem, isn't it? You sure are weird. Okay. Oh, God. Walk out right away at that point, right? They need to be supportive, genuine, caring, positive. We can work these things out for you. Those are some dimensions that are there. Let me just show you this. Elements of positive mental health. When you are a therapist and you're working with people, you're trying to get them to develop as many of these elements as possible. As many of these elements as possible. So, real quickly, just read these. Do you have any of these yourself? Personal autonomy and independence? And then make sure you check down, count the number you have. Last time we were talking about different types of therapy, and I was giving you just a brief introduction to therapy. So now what we want to do is we want to talk about all the different types of therapy, but we want to start off with like a historical approach. What people don't realize is therapists, psychological therapists, have been around forever. There's always been someone in various clans or groups that was the therapist who would go help other people. I guess it was kind of like the oldest child there, or one of the children, I guess the middle child who was going to go save everybody. That's there. You were the savior, I guess, in that one. That's there. So, but over the years, what we have is therapists come about, okay, based on what the paradigm is. You know what that word means? The way of thinking that the people had during that day. And one time, we used to think that if people were had psychological disorders, there was evil spirits that were in their head. Or at least I got that right? That the brain was there. It was evil spirits that were in their head. So the type of therapy they did back then was something called trepanning. And it was very, very easy to do because it had two instruments. One instrument was a chisel and the other one was a hammer. And the type of therapy they did was whack, okay, and make a hole in your head basically to get the evil spirits out. And you know what? It worked pretty much 100% of the time. Because if you died, okay, they said, no more evil spirits, you're gone. Now you're not bothering us. Or two, it rendered you unconscious in a coma state, or that you can no longer act out. Okay, so they thought that worked. Recognize that throughout history, different cultures always noticed that some people were different, didn't they? There have always been schizophrenics during this time. We talked about that last time. But some societies just kind of accepted them. Okay, the American Plains Indians, if you were schizophrenic, they would give you a name, like he who sees visions, or he who talks to the gods. Okay, and as you wandered around talking to imaginary people, they just kind of gave you your space, fed you your food, and let you ramble on sometimes that are there. So some societies were very, very accepting of people, others weren't. Obviously, the trepanning people weren't. The people who did exorcisms weren't very accepting of these people either. So that would be the Catholic institutions that ruled Western Europe for many, many years. What they thought that people who were schizophrenic or psychotic, okay, or acted out, okay, they had what? The devil within them. So the priests would go in and do exorcisms, okay, to drive the devil out. And if that didn't happen, sorry to say, they killed these people. Okay, they burnt them at the stake as witches sometimes. Okay, because they weren't part of the society that's what they were detrimental to it. And then in the 1800s, they had places called, you've heard this term before when you watch horror movies, insane asylums. Okay, where they used to lock people up. Okay, who were very different, who had issues. These were really hideous places, okay? And they basically chain you up all day long or lock you to your bed. They really didn't want to bother with these people. They just put them away somewhere. They did do therapy, and this is a weird therapy. Those of you who do not like snakes, you need to not listen to what I'm going to say, okay? Because they thought that people who had any type of psychological disorders had too much fear in their lives and too much anxiety. So the type of therapy they're going to do is, let's see if we can discover a type of treatment that would be even more fearful of what you're afraid of. And if we did that, then maybe we would shock you out of your problems. So one type of therapy they did, they really did this, was called snake pit therapy. And what they did, they'd have a snake pit and they'd tie you up by your ankles, okay, and lower you down into the snake pit until you were really close to the snakes. Right? And that was supposed to help you in that way and get you over your anxiety. Obviously, that didn't work. Okay? And then around the 1900s, early 1900s, 1930s, early 1940s, they developed something called sanitariums. And these were usually very bucolic places, people out in the country, where they used to really take care of people. Okay, and that's where they first started doing medications and things like that. And by the way, that helped lots of people, because what you do, you took them out of the insane asylums and treated people fairly in that way. And some of the medications also help people. So these were really the earliest forms of therapy, and any culture, any religion has something to help people who they would consider being abnormal. All right, so what we want to do now is start in with what we would consider to be modern day therapists. Who are the people that developed some of the earliest therapies? One fellow who we know already, right, was named Sigmund Freud. By the way, the course that Lauren Montu was telling you about is that one chapter we did on Freud and Skinner and Carl Jung. I didn't talk about Adler. Rogers, Maslow, about how we got to be who we are. And that's the course that she teaches. So you take that 1 week we did and extend it out to 15 weeks and really get into depth on those different theories and how people got to be who you are. Anyway, back to Freud. Freud was probably the father of modern day psychotherapy. Okay? He was the father of modern day psychotherapy. And what he developed was psychoanalysis. Now, Freud was more of a therapist than he was a personality theorist, but in order to do therapy, he developed his theories on it. And what he said was that the focus of therapy was to resolve internal conflicts that are housed in the unconsciousness that lead to emotional suffering. So do you remember Freud? Freud said that we had a conscious, a preconscious, and unconsciousness, and we had issues that developed during our childhood, like some people are orally fixated, some people had anal fixation. Remember all that? And what he said is, in order to help those people, though, they don't really know why they're doing the things they do, so he was there to help them develop insight into what they were doing. And the way he was going to do it is get down into the unconsciousness and pull this information out, make it more conscious so then they could help themselves. Freud was a non-directive therapist, as we talked about that last week. What he would do, he would sit behind the people, and the people would lay down on what they now call a Freudian couch. And what it was is that you'd be laying down, and the back part of it would come up a little bit like this. So you're kind of laying there but looking this way. And Freud would never look at you, and you wouldn't look at him. And he called his people patients, based from the medical model, that I'm the doctor, you're the patient, I know what's right. Okay, don't ask me any questions. Just do what I tell you. Okay, so he was non-directive, but if you ever asked him a question, he'd say, well, what do you think about that? What do you think about that? So everything he was going to do in these techniques I'm going to tell you is for you to try to figure out what was going on in your life, particularly your childhood, because if we can figure out what happened in your childhood, then maybe we can help you as you got older. Alfred Adler, who Lauren Montu mentioned, came after Freud and really studied Freud. And what he did is he talked about the roles that children learn, okay, as they begin to grow up. And we'll talk a little bit about that. So there you are laying down, and then Freud would ask you these questions. One of the things he wanted you to do is to free associate. What is free association? Free association would mean, I'm going to give you a list of words, and I don't want you thinking about this. Just tell me automatically, boom, what pops into your mind when I give you these words. So let me do this with you, but don't shout out your answers. Say your answers to yourself, okay? Because I'm not going to do psychoanalysis with you. So this is what he would do. He'd say, all right, now what I'm going to do is give you a list of different words. And as I give you this word, I want you to tell me, boom, the first thought that pops into your head. Are you ready? Yeah, okay, I'm ready. Here we go. And then he'd give you a barrage. So here we go. You ready? Chair, couch, mother, house. Now at this time, you're thinking, boom, quick, right? You come up with whatever first word that comes to your mind. Okay, so I said house, rug, penis, hair, mother, father, vagina, couch, shoe, penis, sex, mother, star, cowboys, exit, penis, vagina, couch. So what he would do is bombard you with all this stuff. You know, at first I say couch, you say chair, I say mother, you say father. I don't know what you said to penis. Okay, so, and as we go through this, what he's doing at first, you kind of give basic answers. Then after a while, you start getting tired, and your defenses begin to wear down, and all of a sudden, boom, you might say stuff like mother, hate. Oh, where did that come from? Okay, and you just pop out saying that because it comes out of your unconsciousness, and you're not even aware of it. And then he'd write that down, and then he would say something like, well, tell me about that. I asked you mother, you said hate. And then if you said hate, and he would tell me more about that, and you say, no, I never heard my mother. Yeah, but you did say that. And he'd let that go a little bit. Okay? But he'd always come back to it, because he's trying to get you develop insight to what's going on in your unconsciousness. He would do a lot of dream analysis, lots of dream analysis, because he felt that dreams were the royal gateway to the unconsciousness. And he had certain symbols in his dreams that he looked for. So you'd be laying there and he'd say, well, tell me about the dream you had last night. And he'd have you keep a dream journal. And then he'd help you interpret the dream about what happened in your life and your childhood. He'd look for resistance. So if he said to you, well, you said, when I said mother, you said hate. And you went, no, I really don't hate my mother. Well, tell me more about that. What can I tell you? I love my mother. Yeah, but you said hate. Well, that was a mistake. Well, if you kept saying, no, I don't want to talk about that, that means you were resisting. And there might be something going on there, but you're being too defensive and don't want to talk about it yet. So he tried to design other methods to kind of sneak around your defenses to get you to talk about that. And then he always looked for transference. What does this mean? Is that the patient sometimes used to lay there and then transfer feelings that they had in their life onto Freud. Maybe there were a woman who never had a caring father, and here's a man now asking you all kinds of questions and really listening to you. So the woman would begin to really like Freud as a father figure. Or, okay, I mean, you saw the picture of Freud. I mean, he doesn't look like a father figure to me. I mean, he was pretty cold, directive person, okay, who you didn't get much out of. So somebody may say something like, God, you know, you remind me of my father. God never cared about anything. Okay? Well, then Freud might use that as, well, tell me about that. What do you think I'm your father? What would you like to say to your father? Okay? And he would use that to get information out of people. So he would look for what's called transference, where you transfer feelings from your life onto Freud. Okay? All these methods are trying to get you to bring things out and discover your childhood. Okay? Now, a question that I'm going to answer for each one of these types of therapy is, do therapists today use psychoanalysis? And the answer is no. Very, very, very few, very few people really use this. One, Freud said if you entered therapy with him, you'd probably be in therapy for years, sometimes decades. Okay? And you went to see him 2 or 3 times a week. It was a great way to make money. Okay? But 2 or 3 times a week for years. Guaranteed patients that were there. He dealt with people who were very, very wealthy who could afford that in that way. Nowadays, people don't. You don't go into therapy 3 times a week for 10 years. Okay? They just don't do this. Therapy is much quicker. Okay? However, there are people who use free association as a technique to try to figure out what's going on. Lots of therapists use dream analysis. Well, you do look for resistance when people don't want to talk about something. And yes, transference does occur. Sometimes people will transfer certain feelings onto the therapist. So they do use these techniques. Very few people really use traditional psychoanalysis. But I ask you, would you like to understand how my childhood influenced my current personality? I mean, because that's what this does. Now, a lot of therapists, do you want to get yours?
I did.
You got it, okay. A lot of therapists, okay, do this. I mean, I used to do this with lots of people. Let's figure out, you have issues today. Well, what did the issues develop as patterns in your childhood? I didn't use psychoanalysis, but you can get at it in many other ways. So do you people, would you want to do that? Sure you would, right? 96% of you, right, would want to learn more about yourself and how you got to be who you are. And that's the basis of psychoanalysis, particularly your childhood. All right, let's talk about another therapist. His name was Carl Rogers. Remember Carl Rogers from the chapter on personality, right? The humanistic psychologist. Maslow, who we talked about, really didn't do a lot of therapy. Rogers was the one who did a lot of therapy. Okay? And Freud died many, many decades before I was born, but I've seen and met Rogers. I think Rogers kind of looked like his therapy as well. It's a biased statement, I know. Okay? I used to go listen to Rogers speak, and Rogers used to always stand kind of like this. And I'll tell you why in a second. Okay? And he'd stand kind of hunched over like this. And then after the lecture, you could go up and ask him questions. And you'd form these long lines and go up. And he was the type of man, let's say you're with me, okay? And he looks at me and says, oh, hello, and look at my name tag and say, Dr. Link. And then he'd bring out his hand. You got to shake his hand, and he'd bring the other hand. So he'd grasp both your hand and both of his and look you like right in the eye and say, Steve, may I call you Steve? Steve, what can I do for you? And he made you feel like you were the only one, even though there were 100 people standing behind you, okay? Because that was his therapy. That was his therapy. He wanted to give you unconditional positive regard. Why? Because his therapy was a non-directive therapy based on getting you to develop insights, not from your unconsciousness like Freud, but more from your conscious thoughts and feelings, and emphasizing and accepting who you truly are. Remember I talked about how as a therapist sometimes what I do is try to get people to figure out who they are, know thyself. Then after you figure out who you are, then you want to accept yourself, and then you want to just be yourself. Well, that's Rogerian therapy. What he would do is get you talking about yourself, what was going on in your life, and then you would develop insight to who you are, what you're all about. Then he wanted you to feel comfortable with who you are. He doesn't want you to be who your parents want you to be. He doesn't want you to be who the society wants you to be. No, he wants to help you discover who you truly are. Because what happens is that if you didn't get unconditional positive regard, which means what? I care about you no matter what you do. Unconditional positive regard. I love you. I don't like what you do sometimes, but I love you. That should be what parents should be telling children, right? I love you no matter what, but I don't like what you're doing. Okay? Unconditional. And if you didn't get that as a child, then you had issues and problems. So what he was trying to do by grabbing your hand and talking to you, and by the way, why was he hunched over like this? Because his office, I don't see a chair, his office was set up like a living room, okay? Dim lights, maybe some candles, comfortable chairs. He usually sat in a chair on rollers because when you talked to him, he was always leaning forward and looking at you. Those of you who go to restaurants, do you ever notice people who are first dating and as they fall in love, they're really into each other and they lean forward and they talk to each other? Then when you're married for 10 years, you sit back looking around, okay? But when you're first going out, you're like really into each other. I want to talk to you. And that's what Rogers was doing. So he was kind of hunched over all the time. So he'd roll next to you, and as long as it was comfortable, okay, he'd gauge that. And if you started crying about something, he'd reach his hand out and say, if you want, I'll hold your hand. He was kind of like the grandfather you'd all like someday. You know, if you were crying on the couch, he'd say to you, may I go over and sit next to you and put my arm around you? Okay, and you'd cry on his shoulder and stuff, and he'd be there with you. I mean, he was just a kind man, and that was his therapy. By the way, nowadays, they tell all therapists, don't you ever sit next to somebody, put your arm around them, even if they're crying, which I think is kind of cruel, but they always tell you, don't get sued, don't get sued, don't get sued, because somebody may misconstrue that, okay? So it's kind of like, okay. But it's so hard to, you know, if somebody's crying, you're kind of like, okay, cry. You lean forward and You want to be there with them, right? So what Rogers did is he gave people empathy. Okay? I feel what you feel. Okay? I feel what you feel. And the way he was leaning forward, he'd say things like, let's say you might go to Rogers and you may say, oh, Dr. Rogers, I'm really depressed. I've been depressed now for about 4 weeks. Let me tell you what went on. And Rogers would say, oh, well, tell me about that. You've been depressed. Yes, I have. I feel so bad. And he'd say, oh, you feel so bad. Yes, I do. I'm so depressed. Oh, you're so depressed. Yes, I am. Mm-hmm. Rogers was the master of, oh, really? Oh, yes. Oh, you feel so bad. Oh, I can feel your pain. Okay? I know. We used to have a president. They used to say that all the time. He was probably faking it. Okay, that was Bill Clinton. Okay, but Clinton did it with so much sincerity. Did you ever watch Clinton stuff? Clinton would do that. I don't know how I got off into Clinton, but he'd come into an audience and let's say you were a tornado victim or something. He'd come and say, well, tell me, grab your hand, just like look in your eyes and tell me about this is awful. It's just so awful what you went through. I mean, people would melt because he did it with such charm and empathy that's there. Rogers did that. However, he did it because he was genuine and authentic. He really cared. And if you Rogers' training said, if you're going to use my therapy, you've got to really care about the people. Because anybody who's ever had issues in their life knows when people are faking. Because people have issues in their life sometimes can tell on an unconscious basis who's lying and who isn't lying to them. So Rogers said, if you're going to do my therapy, you need to do it with genuineness and be authentic. If you don't like the person, then refer them. Because when they're crying and you're going, God, I feel your pain, you better really mean it. Because you're giving them empathy. You want them to know that they're not the only ones in the world. And by letting them express their feelings and thoughts, they'll figure out who they are and gain acceptance in their lives. Those of you who are really good friends, who are you? Who are you? Come on, there's quite a few of you who listen really, really well. You do Rogerian therapy. Because your friends talk to you and you go, really? Really? God, he is a jerk. Yeah, okay. All right. Oh, man, okay, right. God, I feel so bad for you. That's what you do, okay? And you're an incredible listener. So what Rogers was trying to do is when people have issues in their life, not just Rogers, but all therapists, sometimes a cloud comes over your eyes and you can't see clearly. So what Rogers and many other therapists try to do is pull the cloud away from your eyes so you can see clearly about what's going on in your life. That's the basis of his therapy that's there. Do any therapists use Rogerian therapy? Oh, yes, they do. Just about all therapists use Rogerian therapy to get to know somebody, okay, and begin to build a relationship that's there. Okay? The downside of Rogerian therapy is it's non-directive. If you say, well, Dr. Rogers, tell me what I need to do. I can't tell you what you do. It's up to you to decide what you want to do. And sometimes his therapy would take a long time as well. And if you weren't talking, he wasn't talking. So if you said, I don't know what to say, he'd say, well, when you're ready. So you sit there for 10 minutes and no one says anything. Okay, so he was absolutely non-directive. Never would give you an answer. But for people who can figure things out, it was a great therapy. So let me at this point say, different therapies are good for certain types of people. One, certain therapies are good for certain types of issues. And certain therapies are good for certain therapists. Okay? If you're not a caring person who has a lot of patience, you're not going to do this type of therapy. You're probably going to do behaviorism, okay, which I'll get to. So certain types of therapies are good for certain people, right? And certain therapies are better for certain issues that people have. I would feel good to have Rogers as my therapist, because that's what Rogers wants you to do, is feel good about yourself. All right, so Yeah, a lot of you would. About 82% would do that. Some of you wouldn't. Some of you would go, well, quit just telling me what I just said. Because Rogers did a lot of restatement and reflection. He'd restate what you just said and reflect your feelings that you have. Some of you want more answers. I wouldn't use this type of therapy if I was working with like an engineer from TI or something like that, and I sat there saying, so you seem to be frustrated. Okay, it's kind of like, yeah, what's it to you? Some people are just very logical and rational, and they don't want to do this stuff. But I have other therapies for you people. For one point, according to Carl Rogers, when the information we get from the outside world contradicts our perceptions of ourselves, we become vulnerable for what? Emotional disorders, split personalities, nervous breakdowns, or used car salesmen. What happens when we develop this anxiety, when information we get from the outside world contradicts who we really are? We become vulnerable for what types of issues? What would happen to us? Because that's the basis of his therapy, right? You didn't get that unconditional positive regard, so you really don't know yourself. You're not comfortable with who you are, therefore you develop problems. Don't pick 4, because it's probably true. You can get manipulated very easily. Got it? Ready? 1, 2, 3. Everybody got that one? By the way, thank you for coming here today on a miserable day. All right, so 48% of you are correct, right? It's emotional disorders. Split personalities, that would be dissociative disorders, probably has more to do with abuse as a child. Nervous breakdowns, there's really no such thing as a nervous breakdown. Your nerves don't break down. Remember we talked about that? That probably has to do more with panic disorders than anything else. But emotional disorders. So those of you who didn't get this one right, it could show up on your test, right? So make sure you write down the correct answer. All right, get the right answer? All right, let's talk about another type of therapy. This type of therapy, we haven't talked about this, but those of you who've taken philosophy may know something about existential philosophers. What they're trying to do is they're trying to find out the meaning in life. So existential therapy is done by Frankl, is another insight therapy where they're trying to get you to discover what's going on. By the way, a lot of therapists, most therapists will not tell you. Okay? They're trying to get you to discover what's going on. And this therapy focuses on the elemental problems of existence and trying to make people make courageous life choices. So basically, Viktor Frankl kind of looked like his therapy too. Black rimmed glasses, short hair, wore usually a sport coat, okay, and slacks and a tie. But he had an office like Rogers, but he had a desk in his, and he sat behind his desk, and you sat on the other side of the desk. So he wasn't as emotional with you, and he had some distance with you, because his stuff was more head stuff. His stuff was getting you to think about, why are you here in this world? Existential philosophy. What is the meaning of your life? Why are you here? He advocated free will, that we all have a free will and we can choose to be whoever we want to be, as long as we understand why we occupy this world. Why do you occupy air? Why do you take up air in this world? Okay? Why are you here? Why are you here? So his questions were much more directive, trying to get you to figure things out. So he would go like this. You'd say, oh, Dr. Frankl, I'm here, I've been depressed. So you've been depressed. Yes, I've been depressed. How long have you been depressed? I've been depressed now for about 3 months. Well, tell me about that. Tell you about what? Tell me about your depression. Well, I'm upset. Well, what specifically are you upset about? Well, I'm upset about my job. Well, what about your job? Well, I'm not doing very well about your job. Now, the classic question from a therapist usually is, tell me more about that. Tell me about that. It's an open-ended question. Tell me about that. Oh, I'm just frustrated in my job. Things don't seem to be going well, da-da-da-da. Well, is there anything else that you're upset about? My relationships upset me. Well, tell me more about that. Our wife and I don't get along. Why don't you get along with your wife? He was much more directive with these questions, and then he would get down to the root of it all is, well, why are you married? Just why are you married? Well, I don't know. What? No, that's not a good answer, he would say. You can't say, I don't know. Why did you marry that woman? Well, because I loved her. Well, what does love mean? So then you have to discover what love really means. And he said, on the bottom line is that you're going to have to answer 4 important questions in your life. 1, recognize that we're all going to die. So a type of question would be, I don't like my work. Well, why are you working? Because I have to make a living. Well, someday you're going to die. Yeah, so do you want to die tomorrow? Here lies Steve Link. He died and he worked at a job he never liked. Is that what you want to be known as? Well, no. Well, then maybe we need to develop some important aspects about why you do work. So the recognition that I'm going to die someday. We're not going to get out of life without dying. Okay? Someday we're going to die, so we better live life and make good decisions. 2, we are all free to do whatever we want to do. No, I'm not. I was born poor. I can't do anything. All the rich people take over the world. Well, yes, it's a pretty good indication. You have a little more difficulty raising up. That's very true, but you can choose to do different things. You have freedom. That's there. If you don't grasp that freedom is an existential thought, right? You have to recognize that you can have this. By the way, each one of these people have written very famous books. Rogers' book was called Unbecoming a Person. Viktor Frankl's book was on the man's search for meaning. Viktor Frankl survived the German concentration camps. He was one of the only individuals who lived like 6 or 7 years and survived it. And part of his deal was he saw people who just said, I'm done, and gave up and just died. Some were killed, obviously, but some just died. He also did a lot of work with people who, when they survived the concentration camps like him, who had what he called was survivor guilt, and they killed themselves. A lot of suicides from people who survived concentration camps. Why? According to Viktor Frankl, they never really developed, a sense of freedom. They never figured out what they could have learned from living through a concentration camp. What's the real meaning in life? Why are you here? According to Viktor Frankl, we all need to answer that question. Why are you here? What's your purpose in life? So Viktor Frankl, through more directive questions, helped you develop insight to try to figure out why you're here. You figure that out, then you make your marriage good or bad. You choose a job that you want or you don't want. But you got to figure this out. It would be meaningful to be in existential therapy, because that's what you're searching for, right? Meaning. Now again, this type of therapy takes someone who likes thinking about this stuff, right? Who likes thinking about, why am I here? You're not going to get a lot of emotional support from Frankl, okay? Because he had the desk that was there, and he wanted to ask you direct questions, get you thinking about things. All right, so a little less than the other one, but still most people would think this is interesting, kind of neutral about this. Much more directive. Do therapists use this? Yeah, we use this. A lot of therapists are in psych therapists, but are a little bit more direct than what Rogers was. We only have a certain amount of time, and I know you don't want to come here for the rest of your life, like Freud, or for a couple of years, like Rogers. Let's see if I can push you a little bit more. So a lot of therapists take some of Frankl's work and be more directive, challenging people a little bit more, trying to understand why they do the things they do. All right, here's another therapist. Let me tell you what Fritz Perls looked like and what his office was like, and you tell me what decade he did his therapy in. Fritz Perls had big, bushy gray hair and a big, huge, bushy beard. And he usually wore a flannel shirt, kind of like this, with a corduroy jacket, jeans, work boots. And his office was set up with nothing but beanbag chairs. 60s and the 70s, right? Groovy. Okay, so you'd go into his office and plop down on a beanbag chair, and Carl Rogers was rather rotund. Not Rogers, I meant Fritz Perls was rather rotund, and he'd flop down across from you, and he'd say to you, "Well, why are you here?" And you'd say, "Well, I want to work on things." "Oh," so Perls said, "Do you really want to work?" "Yeah, I really want to work." "Are you sure?" "Okay." He says, "We're going to do it. Are you ready?" "Yeah, I'm ready. Here we go." And he was kind of a jovial guy. His approach focuses on the immediate experience and awareness to help clients rebuild thinking, feeling, and acting in connected wholes. You probably forgot the Gestaltists that we covered the first week of school when I was doing the history of Psych. They said what happened is that if we fragmented our thoughts, feelings, and actions, then we had issues and problems. So he was trying to connect the whole. And he said the only way we can do this is if we snuck up on somebody's defenses. He says we all have, by the way, all of these therapists try to get you to break down your defenses some way or another. And his idea was our defenses are so strong that we don't realize how we feel, and we think a different way and we behave another way. But people who are healthy need to bring the three together. And he emphasizes the integration of our fragmented experiences, thinking, feeling, behaving. But he emphasized staying in the now. All right, so I'm sitting across from Perls, the same problem. "Oh, Dr. Perls, I've been depressed now for quite a few months." And he says, "Well, tell me about that." "I've been so depressed, many different things." "What kind of different things?" "Well, it's my relationship with my mother, my wife, my job." He says, "All right, stop." He said, "You really want to do some work?" "Yeah, I want to do some work." "All right, tell me about your relationship with your wife." "Well, let me tell you about my wife and what an idiot I think she is." "No, stop. We don't talk about idiot wives. Your wife may be an idiot, but we're not going to talk about her. I want you to tell me how you feel about her." "Well, I feel angry." "Good. Tell me about that anger." "Well, I don't know what I can tell you about it. I'm just angry." "Well, you've got to tell me something about your anger." "Look, Dr. Perls, I'm just angry." Now, Perls was a master of looking for nonverbals. So watch me, okay? Look, why do I have to tell you why I'm angry? I'm just angry. I'm just angry. You keep asking me these stupid questions. I'm just angry. He said, "Tell me about your anger." "I'm just angry." "All right," he said, "stop for a second. I see that you're angry, aren't you? You have a feeling that you're angry, but you have a tough time on expressing your anger, right, behavior, and thinking about it and telling me why. We need to get this together." So he says, "You want to do some work?" "Yeah, well, that's why I'm here." He says, "Okay. Seems like you're a little pissed at me, too." "No, I'm not. You're frustrating me." "All right, I'm just getting frustrated with you." He says, "Okay. What I want you to do is I want you to make that fist, because you've been sitting here for the last 10 minutes making a fist like that. Every time I ask you a question, you go like this, you go like this, you go like this. Okay? Okay, you got this fist." He says, "What I want you to do, make a fist and look at your fist." Okay? "All right, I'm looking at my fist." "I want you to talk to your fist." "What?" "I want you to talk to your fist." "What am I supposed to do?" "I want you to ask your fist, say, 'What's your name?'" "What do you mean? It's a fist." "All right, so call him Fist." "All right, hi, Fist." "All right, well, what does your fist want to say to you?" "How the hell do I know?" "Well, good, because that's what the fists do. They yell like what you just did." "Well, this is stupid." You're angry. Look at how angry you are. In fact, what I've noticed is when you talk, you do this. "Tell me about what's going on right here. Put your fist right on your chest right now and tell me what's going on." "Well, nothing." "You're not breathing? You're breathing pretty shallow." "Yeah, because I'm angry." "What are you angry at?" "You." "Do I mind you of anybody?" "Yeah, you're just like my wife." "Oh, is that right? Why is that?" "Well, I don't know why. Leave me alone." He says, "No, you're here to do some work." A little different therapy, isn't it? He says, "All right, now if I was a fist, what a fists do is they like to hit people. That's what fists are for. He says, what I want you to do right now, he says, use your fist. There's a beanbag chair right next to you. I want you to do what a fist does, is hit that beanbag chair. So the person would say, no, this is stupid. No, you got a lot of anger. No, this is stupid. There you go with your fist again. Just hit it. He says, okay. All right. And Pearls would go. If I was a fist, this is what I would do. And Pearls would go, ah, ah, ah. Yeah, boy, he said, that felt good. Let's see you do that. I'm not going to do that. Is that a problem that you have in your life a lot of times? Well, I don't know. Well, hit it. Okay. Hit it harder. Okay, and the guy's in here, he goes, ah. He says, well, tell me now how you feel. Good. Do you feel good? Yeah, I feel much better. Well, let me tell you sometimes, Pearls would say, a lot of times anger turned inward turns to depression. Ta-da. Okay? Oh, okay. He says, yeah, that's what. And then he'd lecture a little bit about all the anger that you have and how it's beat up. But what he was trying to do is use non-traditional approaches to get people to vent all the feelings they had. Because here's a guy who had a feeling, but he wasn't behaving in congruency with his feelings, right? And he wasn't thinking about it appropriately. So he was trying to bring that together, look for the gaps in the experience. Some people get stuck in their heads, they're too intellectual. Some people get stuck in their feelings, okay? Either one of those doesn't allow you to think, feel, and behave in the same way, okay? You own your experience. If at any time you said, well, Dr. Pearls, let me tell you about my mom when I was younger, stop. He'd say, I don't do when you were younger blaming your mom for stuff. Your mom may have had issues and problems. Maybe that's the reason why you do have them. I don't go there. You need to own your experience. If you don't feel good about yourself, the first thing you need to say is, I don't feel good about myself. And we go for there. And you stay in the here and the now. Everything we talk about is what you feel now. Not what happened last week or the week before that or what your wife told you. Tell me how you're feeling now. Because his theory was some people get so caught up in their feelings, okay, that they try to rigidly control them with their thoughts, okay, or they're very angry and they act out and they don't know why they're doing that about their feelings or their thinking. You need to make it congruent. It's a different therapy, isn't it? I would be Gestalt therapy, because that's what he'd want you to be. I want you to be your fist. I want you to be your anger. I want you to be your sorrow. Do therapists use this today? Not a lot have you talking to your fist, okay? But sometimes they use other techniques, like what's called the empty chair technique, which is, I'm going home for Thanksgiving, I'm going to see my mom, my mom, God, I wish I could just tell her. Well, let's make believe your mom is sitting right there right now. What would you like to tell her? I would never tell her that. I'm not telling you to go home and tell her that, but sometimes the cloud becomes over your eyes. I need to get you to pull clear, at least to understand why you are upset with your mother. So just tell her off right now. Okay? Or they have you write a letter to the mother that you're upset with. Don't mail it. Okay? But write a letter to get that out. So that's the type of techniques they may use. All right, so do you like Gestalt therapy? Yeah, here, some of you going, I don't think I want to talk to my fist, right? For some people, this is great therapy, though, because they're not aware of their feelings whatsoever. And they have so much anger, frustration, sorrow, that they're not even aware of it. They bury it so deeply. All right, let's talk about another type of therapy. By the way, we've talked about behaviorism about 5 times this semester, right? We had the whole chapter on conditioning. We talked about behaviorism in regards to personality. The behaviorists like B.F. Skinner, remember B.F. Skinner? He said any behavior designed to actively change. What is behaviorism? It's any behavior designed to actively change behavior. The behaviorists could not care less about what has happened in your life. If you go in and say, Dr. Skinner, I'm really upset, I've been depressed for about 3 months, he'd say, okay, those things do happen. All right, what we need to do is actively design a program to get you out of your depression. I want to tell you about what's happened. Well, you can tell me all you want, okay? But that's not going to help us understand and help you get through depression. What I need to do is develop a series of conditioning programs to make you feel better about yourself. So the first thing we're going to do is when you get up in the morning, I want you to get up in the morning, okay? And as soon as your feet hit the bed and you're out of bed, you just say to yourself, good job. Good job, Steve. Today's the first day that I can do better. You did a good job. And what I'm going to do is do much better for the rest of the day. And what we're going to do is set up a series of contingencies that as you do better throughout your day and you feel a little bit better, I'll reward you with food, money, or whatever. They might say something like, what I want you to do is write me a check. You're a check, okay, to the organization you hate the most. Okay, $500 check to whoever, to the Democrats or the Republicans. And if you don't feel better by the end of the week, what we're going to do is we're going to send that check to those people. Okay, so that's an incentive for you to try to change your behavior. I don't think that works. Okay, but what they use, a lot of operant conditioning. By the way, behaviorism does not work whatsoever for depression. I mean, that just doesn't work. Remember before I said certain therapies work for certain behaviors? Doesn't work for the depression, but it works really, really well with children. Operant conditioning, right? Don't do that, Johnny. Don't do that, Johnny. Johnny doesn't do it. He does the right behavior. Good job, Johnny. Here's an M&M. Good job, Johnny. Oh, I love you so much. Very good. Operant conditioning. You know what operant conditioning is? Rewarding people for doing things. Sometimes they use what's called aversive therapy. Aversive therapy. I want to make you aversive to the behavior that you're doing. The classic ones were done with people who were treated for alcoholism. There used to be a hospital here in Dallas called the Psych centers, okay? And the Psych centers used to advertise late at night all the time. That's why most people are drunk and they're watching late night TV or they're high or whatever else. So they're advertising these programs. And the Psych centers worked on aversive therapy. They'd bring in 30 or 40 people. Your loved ones would drop you off. You were there for a week or two, okay? And you'd walk into this big room, and it was their party room. Back in the 70s and 80s, do you ever remember what disco balls used to look like? They used to hang from the ceiling. The lights used to hit them and twirl around like that. And they had a full-service bar. Any liquor you can think about was there. And the floors were all linoleum floors, okay, that were there on the floors. And they'd bring everybody in, your friends would leave you, and they'd say, hey, okay, we're going to start our program. Here's a pill everybody needs to take. You take a pill. All right, now, I tell you what, we're going to have one blowout party before we start therapy. Tomorrow morning we start therapy, but I know you all want to drink, because that's where you are. You're all a bunch of drunks. We know that. That's why you're here. But we're going to have one more party. So let's get the music started. Any drinks that you all want, go up front. Your therapist will be giving you drinks. You sure? Yeah. Oh, I'll take straight vodka. I'll take this. I'll take that. Yeah, go ahead, drink. And the music is playing. Everybody's drinking. After a while, what happens is that pill that you took was called... Oh, I just forgot the name of it. Anyway, it was a pill that you took, okay, that when it was mixed with alcohol would make you throw up, okay? So you take this pill, okay, the alcohol goes down, mixes in your stomach. Pretty soon you have 30 people on the floor. That's why it was a linoleum floor, easily cleaned up. Like this, thrown up. And the therapist would come out and go, feels bad being a drunk, doesn't it? That's who you are. You're a drunk. Everybody doesn't like you because you're a drunk. You're ruining everybody's life. It's like, man, these people were sadistic. And then what they would do is they'd bring you into therapy and they hook up an electrode on your hand. And they'd say, what's your favorite drink? Scotch. Yeah, here's a shot of scotch. Go ahead, take a... No, last time I did it, I threw up. Hey, take some scotch. Well, what's this? That doesn't matter. It's just, I'm just measuring your... electrofeedbacks that are there. You sure? Okay. And as soon as they brought it to their mouth, this was a shock. They put it to your mouth. They give them an electrical shock. So it was drink, shock, drink, shock, drink, shock. And what it was supposed to do is make them what? Aversive to the certain behavior that was there. And they claimed like 80 to 85% success rate after you left. But they did have it for about a week or two. And then once you know that you're not getting shocked, after all, you take it. But it's called aversive therapy. Another thing they did, and this works extremely well with people who have phobias, it's called systematic desensitization. Systematic desensitization. It works very, very well with phobias. What you do, what is a phobia? You're anxious about something. Remember I told you I had a fear of snakes? But I went through therapy to help me with my snakes. Well, I didn't voluntarily go through this, but I guess I did. I was in graduate school. And when the teacher got to this point in the semester, and they said, well, I'm going to show you how to use behavioristic techniques. They said, who's got a phobia? And people in class knew I didn't like snakes. So they went, Link does. Link does. He doesn't like snakes. I went, I don't like snakes. He said, good, come on up. By the end of the semester, we're going to have you walk into this classroom, pick up a snake, and put it around your neck. And I went, oh, gosh, no way. He said, we're going to do that. Do you want to do that? I said, do I have a choice? He said, no, your grade depends upon it. I said, oh, okay. So I was the so-called guinea pig. Not that the snake was going to eat the guinea pig, but... So what they do is, the first thing they do is they teach you to relax. Because remember, too much anxiety. So we went through various relaxation methods. Then they began to slowly expose me systematically through a hierarchy of fears. What's the most intense fear? Picking up a snake, putting it on my shoulders. What's the least fear? Looking at a picture of a snake. So what they did, they showed me a picture, and supposedly there was a snake laying over there. I could barely see it. Snake, relax, relax, relax. Snake, relax, relax, relax. Because remember, my issue was snake, anxiety. Snake, relax, relax, relax. Picture a close-up of a snake. Relax, relax, relax. Picture, relax, relax, relax. Picture, relax, relax. Picture. Yeah, I'm okay with that. What they were doing was systematically desensitizing me to the snake. Boom. Next step, they brought in a snake. Somebody in the class actually had a boa constrictor as a